In this video, we're going to talk about exercise after having surgery to remove a plate and screws from an ankle from a prior injury. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Ankle fractures are very common, and typically if you need surgery to fix it, it's going to be a plate on this bone, the fibula, or the bottom part of it called the lateral malleolus, or it may be a couple screws on the inside of the tibia, the medial malleolus. Most of the time, people do fine without any surgery to remove those. It's just one of those things. Sometimes you can feel the screw heads, but not a real big deal. But especially in very thin people, especially that plate and screws on the outer bone, the fibula, can be uncomfortable. And so people have a second surgery to go in and take that hardware out. But when you do take that hardware out, it leaves holes where the screws were going through the bone. And so in theory, before you start really aggressive sports or exercise, you want bone to fill in those holes. So for an activity like running, long distance jogging, or any kind of sport that involves jumping, pushing off, things like that, you're probably looking at a minimum of 6 to 8 weeks to allow that bone to fill into those holes to minimize the risk, albeit a small risk, but minimize the risk that you break right through it. But that doesn't mean you couldn't do other forms of exercise sooner, things like stationary bike and spin classes, yoga, rowing machines, lifting weights, something like that might be something you could do much sooner than that. If you like videos like this, make sure to subscribe and ring the bell to be notified either when I start a live stream or release a new video. If you'd like to see me as a patient, I'd be happy to see you. I'm a double board certified orthopedic surgeon, and I talk to you about all of your options, not just surgery or cortisone or physical therapy. There's a link in the description below where you can contact me and my team to find out potentially about seeing me as a patient or other ways to work together. Thank you so much for watching. I look forward to helping you feel and perform better than ever.